Today, I'm going to be talking to you about the Picture Exchange Communication System. What is PEX? PEX is a picture-based communication system that was developed by Andy Bondi and Lori Frost. PEX is an aided communication system. This means that it is a communication system that uses a tool or a device. PEX has a teaching protocol, and the teaching protocol is centered on Skinner's verbal behavior. There are 6 phases of PEX. I will briefly review all the phases. PEX Phase 1 teaches students how to communicate. Here, the students will request for the desired item by exchanging one PEX picture icon of the item they want to the communication partner. PEX Phase 2 teaches distance and persistence. This means the students will learn to travel to their communication partner and their PEX book to communicate their needs and wants. PEX Phase 3 teaches picture discrimination. Here, the students will learn to discriminate between multiple PEX picture icons on their book. PEX Phase 4 will teach sentence structure. This means the students will learn to use a phrase. Since the students have mastered the communicative function of requesting, PEX Phase 4 will begin with using a sentence starter to request for desired items. For example, I want iPad. The next phase is called the attributes phase. Many of our students like specific things. For example, some of our students only like to eat the red fruit Skittle or wear the red shirt. PEX Phase 5 teaches our students responsive requesting. This means the students will learn to respond to questions. For example, they will learn to respond to, "What do you want?" PEX Phase 6 is where the students learn sentence structure. Here, the students will learn to spontaneously tag items or comment. Who can use PEX? PEX is widely used with individuals with autism spectrum disorder. PEX is also used with individuals with aphasia. Aphasia is a brain injury that weakens the individual's speech and receptive language. PEX is used with individuals with apraxia. Apraxia is when the brain has difficulty sequencing the phonemes and oral movements. This is not due to muscle weakness. PEX is used with individuals with Alzheimer's disease. PEX is used with individuals with cerebral palsy. Cerebral palsy is a disorder of muscle movement or muscle tone or posture. PEX can also be used with individuals with cognitive impairments. What does the literature say? Research has shown that PEX is effective in increasing functional communication skills in individuals who have language delays. Additionally, children have increased their MANs, which led to a decrease in problem behavior. For example, Hugh and Lee, 2019, found that when children learned PEX phases 1 to 3, their MANs increased and their aggression decreased. Research has also demonstrated that when children learn PEX, there is an increase in vocal speech. What are the long-term benefits of PEX? One long-term benefit from PEX is that it teaches children functional communication skills that they can use long after they graduate from school. Another long-term benefit is that PEX helps decreases problem behaviors in students with autism spectrum disorder. Let's think about functional communication training. Before functional communication training is implemented, the antecedent is that the student is thirsty, the behavior is that the student hits the staff member, and the consequence is that the student receives the water. However, after functional communication training, the antecedent is that the student is thirsty, The behavior is that the student exchanges the water PEX icon with the communicative partner, and the consequence is that the student receives the water. So the problem behavior of hidden staff members is replaced by a functional communication skill, which is exchanging a PEX icon with a communication partner, and that is how the student communicates their wants and needs. Another long-term benefit of PEX is the generalization of the skills that they learn from the PEX protocol. The PEX protocol helps with generalization of all the skills that they learn. For example, the students learn to communicate with communication partners across multiple settings, across multiple communication partners. What are the short-term benefits of PEX? One short-term benefit of PEX is that it increases communicative responses between students with autism spectrum disorder using PEX and their communication partner. Students learn to walk up to their communication partner, initiate a communication interaction, demand from their communication partner, and tact or comment. Another short-term benefit of PEX is that it helps increase vocalizations or vocal speech in students who use PEX. What are some challenges in the school and for family members? One challenge is that students may engage in problem behavior. And when the students engage in problem behavior, this is difficult both for the school staff members and for the families. The school staff members and the families may not know what the function of the student's problem behavior is, and they may not know how to analyze the stimuli in the student's environment. Another challenge is the belief that the staff members or some family members think that PEX decreases the student's vocal speech. As stated earlier, research has shown that PEX has helped increase vocalizations. Another challenge is that teachers or families are not trained in PEX. They're not sure how to teach PEX to the students. What skills should we teach? One skill that we should teach to our students who use PEX is the verbal operant commands, or an independent request. If our student can learn how to independently demand or independently get their needs and wants met, this is a functional communication skill that can replace their problem behavior. We should also teach our students the physical picture exchange. We need to teach our students how to grasp the picture icon, pick it up, and exchange it with their communication partner. Another skill that we should teach our students is to travel to their PEX book, get their PEX icon, and bring it to their communication partner. Their communication partner is not always going to be right in front of the student. Their PEX book and the PEX icons that they want to exchange are not always going to be right in front of the student. So they need to learn to search for their PEX book, search for the icons, and then search for the communication partner that they want to communicate with. Another skill is picture discrimination. There are going to be many different picture icons in the student's PEX book, and they need to learn how to discriminate between each icon. Another skill that we need to teach our students is to increase their sentence structure during requests. So instead of requesting using one word, we can teach our students how to request using a 3-word utterance. For example, I want cookie. We should also teach our students how to use attributes. A lot of students have specific requests. For example, I have students who only like the red flavored Skittles. Another skill that we should teach is responsive requesting. The student should be able to answer the question, what do you want? Lastly, we should teach our students the verbal operant of tact in. They should learn how to label or comment. So for example, if a student sees a nonverbal stimuli, they should be able to label that item. What are some teaching strategies? One teaching strategy is prompt fading. Prompt fading is when the student engages in a response to a prompt, and the prompt will eventually be eliminated systematically. For example, a full physical prompt is used to guide the student to reach and exchange the PEX icon. This will eventually be reduced to a partial physical prompt and then eventually be eliminated altogether, because the goal is for the student to independently reach and exchange the PEX icon with their communication partner. Another teaching strategy is the time delay prompting. This is when the time interval between the discriminative stimulus and the prompt is increased as the number of opportunities increase. The last teaching strategy is the 4-step error correction. So when the student demonstrates an incorrect response, the 4-step error correction procedure is used. The 4 steps are model and show, practice, switch up the task, and then repeat. So to summarize this presentation, PEX is a picture-based communication system. It helps increase functional communication skills in students with language delays. PEX can help increase vocalizations or vocal speech. PEX follows a protocol which incorporates behavioral interventions, and it was developed around Skinner's verbal behavior. Thank you for listening to my presentation, and I hope you enjoyed it.